Shirley. We're going to talk today about knowing your thyroid better. We see a lot of patients here at Hinduja Hospital who come with questions about their thyroid. Some of them have real thyroid problems. Some of them are wondering if they have thyroid problems. So it seems to be commonly on people's mind, and definitely thyroid disease is on the rise. So it's good to be more aware of what could be a thyroid problem if you need to get checked. So what is the thyroid gland and where is it in your body? It's a butterfly-shaped gland in the bottom of your neck. So you can see it sometimes if you swallow, and if it's enlarged, then you'll see something moving in the base of your neck. You can sometimes do this by looking in the mirror, or sometimes friends and family may tell you that it looks like you have a bulge, or some people call that a goiter, which is an enlarged thyroid gland. You can sometimes check this by drinking some water or swallowing some saliva and observing your neck in the mirror. And you would be looking at the base of the neck, which is where your thyroid gland sits. So right here, you see, this is at the base of your neck, underneath the Adam's apple or the voice box, which men have. And in women, it sits really above the collarbone, which is where you can see it. Now, the most common way of assessing anybody's thyroid is with a blood test called TSH. And TSH is a hormone that comes from the brain, and it controls the thyroid gland. It's a very, very smart and precise hormone, and is more useful than the free T4 and free T3 that a lot of patients come in with. It seems to be a default on many of the thyroid packages or thyroid panels. But for the most part, in a usual common patient, TSH is the useful and quite sufficient blood test to start with. What it really is like is if you, for example, have set your air conditioning to be 26 degrees Celsius, once the temperature starts to get too warm and the room is getting above 26, for example, it's trying to become 27 degrees, then the thermostat in your AC realizes and starts blowing cold air. It's something very similar. TSH is like the thermostat. So if the TSH realizes that your thyroid is becoming slow or is becoming underactive, then the thermostat says it's time to blow more TSH, and it's called thyroid stimulating hormone. So it's time to stimulate the thyroid gland to make more thyroid hormone. So in somebody who has a tendency for an underactive or a slow or a hypothyroid patient, their TSH will start to go up. Okay? The opposite will happen if somebody has a overactive or hyperthyroid tendency and the thyroid is making too much hormone, then the TSH realizes that it's getting too fast and it stops making thyroid stimulating hormone, and it says we need to stop stimulating the thyroid so much because it's already overactive, which is when you see somebody with a low TSH in a hyperthyroid patient. Okay? So I get this in the office a lot. They come in saying, wait, is it my thyroid? People say some thyroid patients gain weight, some thyroid patients lose weight. How do you know which is which, and what am I suffering from? Now, only some people who are losing weight because of their thyroid. Not everybody's weight loss is coming from a thyroid problem. And not all thyroid patients lose weight if they're overactive. So you have to really take the question very carefully and assess each patient. One thing that's a quick guide is if your TSH is within the normal range from whatever lab you get it done, there's always a normal range given. If your TSH is in the normal range, then you are not going to gain or lose weight from this thyroid. If you are losing weight and your TSH is extremely low, then we should consider that you might be losing weight from an overactive thyroid. Okay? And what would a patient with an overactive thyroid look like? They would have eyes which might be bulging. They would have a TSH that is much lower than normal. They would feel weight loss. They would feel nervous. They might have a swelling in the neck. And they would have many other symptoms which we've listed here. Again, overactive is hyperthyroid, and the things that you come with are weight loss, nervousness, lack of sleep, hands are shaking, your heart is racing, feeling anxious, nervous, sweaty, feeling very hot. Even in an AC room, sometimes hyperthyroid patients are feeling very hot. Going for bowel movement very frequently, multiple times in a day. And if you're a lady, then your menstrual periods might become very light flow or very less blood flow. And again, the quick blood test that might point to this is a very low TSH. So what things should you do for a blood test for this? TSH. Some patients, free T4 is useful. We would do a nuclear scan. Usually the cheapest and fastest test to do is with technetium. It's a nuclear photograph. Helps us understand what is the reason why your thyroid is acting too fast or overactive or hyperthyroid. And in some patients who have very bulging eyes, like frog eyes, those patients might need a TSH receptor antibody. What are the treatment options if you have hyperthyroidism or an overactive thyroid? We need to block the thyroid hormone production. This can be done with a medication called carbimazole, which is sold in the market under many different names by many different companies. You need to look for what's the active medicine inside. It should be carbimazole. Some special patients might need steroids along with this. You have to really talk to the doctor about it to see if you're the right patient for it. The other option is to destroy the thyroid gland completely with radioactive iodine. This is very different than radiation that we use in treating cancer. This is a much safer and much simpler medication that you actually swallow, and the radioactivity goes only to the thyroid gland and is extremely safe, and I recommend it for a majority of my patients. The last choice is surgical removal of the gland. There are certain patients where this is the first choice, especially if they have a very big goiter or a very enlarged gland, or if they have a nodule or a lumpy gland, which is causing squeezing on the food pipe or pressure on the food pipe, or on the windpipe, where there's difficulty either swallowing or breathing. These things would need surgery so we can remove that pressure. And you could do either total thyroidectomy, which means removal of the entire thyroid gland, or partial, where you only remove the enlarged piece and you try and leave some of the normal thyroid tissue behind. The benefit of leaving some of the tissue behind is you may not need to be on lifelong thyroid hormone replacement. Because what will happen if you destroy the whole thyroid gland with radioactive iodine or by doing surgery and removing the whole gland is you still need a normal amount of thyroid hormone, and you would have to take that by supplement from a bottle, a tablet every day for the rest of your life. So if there's a way to avoid that, we try and avoid that. But again, if you need to take lifelong thyroid, it's a very safe and a very easy thing to do. And once you're on the right dose, you just need a blood test once a year. So it's quite simple. This question I get very, very commonly in the office. This is one of the most frequently asked questions about thyroid. I'm gaining weight. Is it coming from my thyroid? And most people, unfortunately, I would say, with weight gain do not have a thyroid problem that I can fix because their thyroid is actually just absolutely fine, which is bad news for the person asking the question because it means that they have some hard work to do and focus on why are they gaining the weight, why have they, what is their health style, food intake style. They have to really look at their diet and exercise. But most of them will want to make sure that the thyroid is not causing a weight gain problem. So yes, it is true. Some people with a underactive or slow or hypothyroid condition will gain weight. But again, most people with weight gain have a normal thyroid gland, okay? And not all thyroid patients end up gaining weight. So the short answer is, in order for a thyroid problem to cause significant weight gain, the TSH really needs to be much higher than the normal range, okay? If your TSH is in the normal range, you will not gain or lose weight from your thyroid. What are the symptoms or things you will see if you have I'm sorry, there's a typing mistake on that slide. It's underactive or hypothyroid, Hypo thyroid, where your TSH value goes much higher than normal. And again, if you remember the example of my air conditioning, if the thyroid hormone level is dropping, then the TSH coming from the brain, which is thyroid stimulating hormone, realizes that the thyroid hormone levels are falling and says, I need to stimulate this thyroid to make enough thyroid hormone. So TSH levels rise in the efforts to stimulate the thyroid. So high TSH, much higher than the normal cutoff that's given in your lab report. So that would be a hypothyroid or underactive person who has a very high TSH. Okay? So what are the symptoms in a hypothyroid patient? Underactive thyroid gland, weight gain, yes, in some few patients, fatigue, drowsiness, tiredness, low energy, constipation, dry skin, feeling quite cold, even in the hot city that we live in, Mumbai, feeling very cold can be from thyroid. And bleeding, if you're a lady, your menstrual periods can become heavier flow. A lot of increase in blood loss can come if you have a hypothyroid state. And again, the differentiating point is the TSH would have to be much higher than the normal range for this to really cause a clinical effect or to cause real symptoms. Okay? So what are the tests that we do if we are suspecting underactive thyroid? TSH is the starting test. Very rarely we would check a free T4. Not all hypothyroid patients need their free T4 checked. And the most common cause for hypothyroidism is Hashimoto's disease, which is an autoimmune thyroid condition where your immune system, by mistake, starts to attack your thyroid gland. The function of the immune system is to keep us safe from infections and cancer and TB, malaria, cancer cells. Those are the things that it needs to destroy. By mistake, in this type of situation of Hashimoto's, the immune system is now attacking the thyroid gland. In that situation, the TPO or microsomal antibody levels will be high. Okay, that's something that runs in families and usually predicts that you need to be on lifelong thyroid hormone replacement. Now, what is the treatment for hypothyroidism? Is again, like I said, for the other condition is for hypothyroidism, you need to take lifelong thyroid hormone, easy to take. It comes in a bottle. Take it once a day in the morning, empty stomach, 30 minutes before breakfast with just plain water. Nothing else has to be taken with thyroid hormone, and you need to take this lifelong. Usually, if a dose change is made or if you're started on a new thyroid dose, then we check the TSH. Then we check the TSH in 6 weeks. The last thyroid condition I'll talk about is thyroid nodules and cancer. And the thyroid is a gland, and like any other part of the body, sometimes it can develop lumps or bumps or cancer. The voice is breaking, okay. So sometimes the thyroid gland can develop nodules or lumps or bumps or cancer, just as we can have in any other part of the body. And most of the thyroid lumps or bumps or nodules are not cancerous and they are benign. And the way to know that is by doing a thyroid ultrasound and a biopsy with a fine needle. Okay, so some of these you see because some patient was getting a scan of some other body part, and by the way, they found a nodule in the thyroid gland. Some people have a very obvious enlargement in the neck, which you can see as a goiter. That's what the common word is, goiter, which is enlarged thyroid gland. And once you see nodules on an ultrasound, usually the nodule has to be bigger than 1 centimeter, or if it is less than 1 centimeter, then it have some worrisome findings on the ultrasound, some suspicious looking findings that make you wonder about cancer. In those situations, you go ahead and do a fine needle biopsy. This is a very small procedure, easily done by a radiologist, or some physicians also do it. And a fine needle is put in, and a small piece of tissue biopsy is done and sent to the pathology lab where they make slides and they look for cancer. Again, 95 to 98% of thyroid nodules are not cancer, but we need to make sure, and this needs to be confirmed only by biopsy. Once you confirm that it is not cancer, then you just need to do a follow-up ultrasound maybe in 6 months. And if it's been stable and the nodule has not grown in size, you can do an ultrasound once every year just to make sure that it's not getting any larger. If it turns out to be thyroid cancer, then you need to see an endocrinologist and maybe even a specialist for radiation, a nuclear physician, to arrange for surgery as well as destruction of the remaining thyroid tissue. And then we plan for continuous lifelong follow-up of the thyroid cancer. I'll just say that thyroid cancer is one of the best cancers to get. If you were to ever get cancer of any body part, thyroid cancer is one of the easiest cancers to treat. So we already talked about this. If your nodules are stable and there's no cancer in them, then you just follow up with frequent thyroid blood tests with TSH, right, like I said, ultrasound in 6 months and then in 1 year to make sure that the nodule is stable. And if it is cancer, then you need surgery, you need lifelong follow-up with an endocrinologist, as well as a nuclear doctor for potential radiation to destroy whatever remaining cancer is left, and then lifelong thyroid hormone replacement. So with that, I come to the end of the talk per se, and we'll look over if there have been any questions. Mm-hmm. So, hi Preeti. Sorry you have those symptoms, but based on your body weight, we usually decide how much is the starting dose of thyroid hormone replacement. And yes, and these are some of the common symptoms that you see in somebody who has hypothyroidism. Some of them you mentioned, weight gain, dry skin, some palpitations, which doesn't necessarily go with hypothyroidism, but again, it's hard to know everything, whether it's coming from thyroid or not. The most important thing, Preeti, for you to know is your TSH, which is thyroid stimulating hormone blood test, is that test within normal range? Okay. If that test is within normal range on the 100 microgram dose, then most of your symptoms are not explained by your thyroid. Okay? Once your TSH is normal, that means your body thinks that you have enough thyroid hormone and your pituitary gland is happy and the control center is happy and the TSH level is in the normal range. It doesn't know whether the thyroid hormone is coming from a bottle or whether it's coming from your gland in your neck. So if you're still having symptoms after your TSH has been normal, then you need to talk to your family doctor about what other causes there could be, whether it's a vitamin disturbance causing the dry hair and dry skin, or if it's too many calories being taken in, which is causing the weight gain, or a sedentary lifestyle causing the weight gain. So many other things need to be considered. And if your TSH is outside of the normal range, then you need to see the doctor to get the dose adjusted. Okay, so good question. The first and most basic test to do for a thyroid patient is a TSH, that is thyroid stimulating hormone, that comes from the master hormone gland in the brain. It's the pituitary gland, that is the master control center for all the hormones in the body. That gland makes TSH, which controls the thyroid. Okay, so for, I don't know what your thyroid condition is, but in the initial phase of a new thyroid patient, we see the baseline or the starting TSH. We make our decision on what treatment needs to be done, and usually we repeat that TSH in 6 weeks. It does not make sense to check it sooner than 6 weeks, except in pregnancy, when you will check it in 4 weeks. Checking it sooner than 4 weeks in anybody is not useful at all, and it's quite unnecessary. Once the 6 weeks TSH has come into the normal range, then you can check it probably in 6 months, and then follow up in 1 year. And if it is continuously stable, then you can reduce the frequency to once a year. Now, if that 6 weeks TSH is not fixed and it's not in the normal range, then you need to see the doctor to get your medications reviewed so that the doses can be changed, and hopefully the TSH will stabilize in the next checkup at 6 weeks. Very good question. Yes, for sure. Thyroid is getting to be a very important subject of discussion in pregnancy. There's big discussion between the endocrinologists and the obstetricians groups. We just had a new guideline, brand new guideline, come out from the Endocrine Society of America, which is a published guideline. You can find it on the web, on the internet, which describes the management of thyroid disorders in pregnancy. This is a very important topic because in the first 3 months of pregnancy, the newborn, the infant inside, does not make its own thyroid hormone, the fetus. The fetus is depending on the mother's thyroid hormone levels. So mother's thyroid hormone levels need to be quite healthy before pregnancy. And what I tell all my young ladies who are in the office, even if they're not even married, not even pregnant, I always tell them your TSH needs to be correct before you get pregnant. Why do I keep saying this? Because more than half of pregnancies around the world are not planned. So you need to always be aware, if you do get pregnant, it's quite the recommendation that you should check your TSH as soon as you become pregnant, if not get it fixed beforehand. And the important thing is the baby's intelligence depends on good levels of mother's thyroid hormone in the first 3 months. So whichever mothers want intelligent babies, they need to make sure their TSH is fixed before pregnancy. Good question. Thyroid cancer many times is sporadic, where it just happens with no real reason, maybe something in the environment which hasn't been identified yet. There's a lot of research going on in the Western world to try and find causes of thyroid cancer. We do believe that there are more chances of thyroid cancer in places where there is not enough iodine in the diet, which is iodine deficiency. But nowadays, with us making iodized salt, the salt that we eat in our food has iodine now for this reason, so that we eliminate iodine deficiency as a cause. Some thyroid cancers run in families. Some thyroid cancers happen after radiation to the neck for some other cancer. So somebody who might have had cancer of the throat or of the voice box and got radiation to the neck, that caused some damage to the thyroid, and then years and years later, they developed cancer in the thyroid. There is a small chance of also the other situation where you can have thyroid cancer is the radiation blast victims from Ukraine, where the Chernobyl disaster happened, and there was spillage of radiation that caused a significant increase in thyroid cancer. And the other situation is radiation for lymphomas in childhood. So any history of childhood neck cancers can cause thyroid cancer in adult life. So these are some of the common reasons why thyroid cancer happens. Good question. The thyroid gland controls our metabolism. So what I describe to the patients in the office is thyroid hormone is like the gas or petrol in your car. If you put too much acceleration on your vehicle, too much petrol goes into the engine and the car starts to drive too fast. Okay, so if your thyroid is overactive, your metabolism gets too fast, and that is called hyperthyroidism. If your thyroid hormone levels are too low, your metabolism slows down, you become tired, you gain weight, you become lethargic, and that is the equivalent of having an almost empty tank of gas or petrol where your car is almost running out of petrol and it starts to slow down. So thyroid hormone is a very important metabolic hormone. You need it to stay alive and to stay healthy, and you need it in just the right amounts. And you asked about what is the function of hormones. Hormones are chemicals that circulate throughout the body and have action throughout the body on all the different organs. So thyroid hormone affects the entire body. There are hormones coming from the adrenal glands, that are stress hormones, there are steroid hormones that affect every part of the body. Insulin is a hormone that controls diabetes. So many different hormones to control minerals, metabolism, sugar balance. Basically, they help to keep the whole body in balance. It's done? Okay. So I think we've come to the end of the webinar. Hopefully, most of your questions are answered, and you can follow us. You can email us. We are on the web, and we'd be happy to take more requests for other such topics of interest. So hopefully, this was useful to you. So we'd appreciate your feedback. Bye-bye.